Hi, again, my name is Dr. Gail Walker. I'm with Walker Wellness and Chiropractic. My husband and I, Dr. Scott Walker, have a practice in Chalfont, Pennsylvania. We've been practicing there for 20 years. We are very active in the community, very active with the Lions Club, and I am, in fact, very involved with the Central Bucks Chamber of Commerce. I'm the co-chair, in fact, of the Health and Wellness Committee there. So we go out and we do a lot of these speaking engagements, and so I'd like to welcome you to this. I believe that this will allow you to enjoy your life, and your family will be able to enjoy their life, because I'm going to talk to you about how you can stay young for the first 100 years. Now, I can already hear what some of you are thinking. Well, that seems pretty catchy, that name, and it's, you know, do I really need to know how to stay young for 100 years? That seems pretty ambitious and a little bit far-fetched. Well, it's really not. We all need to start thinking about what it means to live a long life. So let's look at some of the facts here. The fact is, people are living longer and longer. It used to be that the average lifespan was 49 years of age. Well, you know, the reality is people did die at a younger age. There weren't as many cures. We didn't have as much advancements in our healthcare that we do today. So people's chances of living longer weren't as great as they are today, because in fact, today, as you see here, the average lifespan is 77.6 years of age and growing. In fact, a report from scientists from the University of Texas on the Today Show in 2006 had told us that by the year 2050, 800,000 Americans are going to be living to the age of 100, and many to the age of 150. So what does that mean? Or more importantly, what does that mean for your kids? Well, what that means for your kids is they need to know how to take care of themselves. More importantly, then they need to stop thinking about how they're maybe going to spend your inheritance, because chances are they're going to be retired themselves before they would even get that inheritance. Of course, that's assuming that there is some. So we already know that we're going to be existing on this planet. We want a good quality of life. We want to be able to move and work and play. So we really need to start thinking about what we need to do to allow that to happen, since the chances are huge that we're going to be living a very long life. So let's look at some of the things that are happening right now. We have this huge onslaught of baby boomers that are now moving into the over 50 category. And we're seeing a lot of flaws in our healthcare system that we really never knew existed before, just quite simply because people didn't reach this age. So we are seeing a lot of things that are going on, unfortunately, with the mental devastation of Alzheimer's. And it isn't that Alzheimer's just happened, it's just we didn't know that much about it, because dementia doesn't usually come on a person till the age of 70. So now that we know we're going to be living this long, we need to start taking some measures to make sure that we're able to use our minds when we get to that age. Also, cosmetic changes, that's huge. There's a lot of increase in the number of cosmetic surgeries for people's desire to stay young to cure the wrinkle problem. But more importantly than that, what we are seeing, the biggest problem that we're seeing is a neglect with our structural system, with our musculoskeletal system, our mobility function. And the reason being is people are living longer and longer, they're using their spines more and more, but they're not doing anything to take care of their spines. So because of that, the most common cause of functional disability in persons over 50 are spinal disorders. So we just talked about the statistics. How many people in this room would like to live past 50, or if you already are past 50, how many of you would like your children, or think now after the statistics we just saw, are going to live past 50? The chances are huge. So what we need to do is we need to start doing something about this. We need to be able to make sure that we're able to move when we get to that ripe old age. So here's an example that I'll give you. If I could tell you that I knew someone was going to rob your house, I knew when they were going to do it, who was going to do it, and at what time. Do you think that you would do something to prevent it? Well, absolutely. Most people would want to prevent people from stealing their possessions. Well, I can tell you when your mobility function is going to be robbed and how it's going to be robbed. That's a lot more important to protect and prevent that from happening than your possessions, which can be replaced. So we need to start thinking about taking some preventative steps to make sure we have our mobility. Think about this statement. If you lose your mobility at 65 years old and you live to 105, that's 40 years of immobility and pain. That's a lot of years of immobility and pain. So let's look at some of the advancements in our healthcare system now. We've noticed a lot of changes. Specifically, let's take the dental industry. It used to be that people had a lot more cavities, people's teeth fell out, and now people's teeth are lasting longer and longer because we've made a lot of advancements with this. We take our kids to the dentist before they even have teeth, we brush our teeth, we floss, we take much better care of our teeth, and guess what? As a result, our teeth are lasting longer and longer. Wrinkles. There's been a huge increase in this industry. Since 1997, there's been a 465% increase in the total number of cosmetic procedures. 465% increase. That is 12 million cosmetic adjustments for people's desire to stay young, to look young, to solve that wrinkle problem. You know, but I'm all for nice white teeth and not having any wrinkles and looking nice, but I can tell you this, your lack of mobility will make you look a lot older than crow's feet. If you can't move, it doesn't matter if you don't have any wrinkles or you have nice white teeth. So that is really, really important to know. Because again, we don't want to just exist here. We want to be able to do things as we get older. Why don't people take care of their spine? For the plain and simple fact, if your spine were on your face, you would take better care of it. We no longer wait for our teeth to fall out before we take care of them, right? So we shouldn't wait for our back to go out before we take care of it. Take the gamble that you're going to live past 50. Your children are going to live past 50. They need to do something to make sure that they prevent the problems from occurring. And why is preventative care so important? It is so important because there is no such thing as a spine transplant. There is no such thing. You can get a new set of teeth. In fact, you can get a lot of other organs replaced. But once your spine wears out, there is no turning back. You cannot get a crown for it. You cannot get a replacement for it. You can't get a new one. So you just have to live with the pain. And this is just not limited to back pain. If you look here, in a study of 10,000 adults, 1 in every 3 people suffer from neck pain. You can't get a new neck either. So let's see by a raising of hands here. How many people after the age of 50 would like to use their neck without experiencing pain? I know I would. We all back out of our driveways, right? And we need to turn our neck. So that's a pretty important thing to have. Here we have 85 out of 100 will suffer with low back pain. So we have 85 out of 100 suffer from low back pain, 1 out of 3 with neck pain. That's a lot of people walking around with a lot of pain. That's about as high enough of a statistic I think anybody would want to hear to know that they need to do something about this to prevent this from happening. And why is it that those statistics are so high? It is because people wait till they are in pain before they do anything about it. You know, they're not taking those preventative steps that they need to take. So in case you're still wondering, all right, what was going to happen to me if I just let nature take its course? You know, I'm not really convinced about this whole preventative thing. So let's just look at what happens here on this scale if we just let nature take its course. So what we have here on the bottom is age. And what we have here on this side up here is your mobility scale. That means your ability to function, your ability to move. If you take a look at this blue line here, and you follow it all the way up here, here we have 100% maximum mobility at about the age of 25 years of age. So when you're 25 years of age, you're at 100% mobility function, okay? What happens to that blue line after? It just drops off, okay? So if we look here, by the time you're 60, I'll say 50 here, by the time you're about 50, you're about 25% of the mobility that you had when you were, or excuse me, let's say when we're at 50, we're about 50% of the mobility that we had when we were at the age of 23. Now, I know some of you that may be around 50 or know people that are around 50, and people that I've spoke to, they say 50% is pretty conservative. I actually feel a lot worse than that. By the time you are here at 60 years of age, you've lost you only have 25% of the mobility function that you had when you were 23 years of age. So that's a lot there. So you might be thinking, okay, can the scales be changed? Is there anything that can be done? Is it too late? And what here we are looking at with some preventative care. If you see this line here again, that is just what happens normally. And it drops off there, so we're reached at our maximum mobility, and it just drops like a rock there. We are able to hold a person's mobility function over 75% through those golden years. Okay, so that's those vitality years that people are retired now and they want to be able to do things, golf, play with their grandkids, do things. So we are able to hold a person's mobility function there. And that is what people want. They want to be able to move because they worked so hard their entire life. So you might be saying, okay, I'm already past 50. Is there anything that can be done for me? I've already waited till I'm in pain. Can the scales be changed for me? And what we always say to patients that come into our office, and they come in pain, we say, congratulations. It's never too late to start. We can get to work and put you on a plan where we can get that function back. But what we tell them to do is they need to follow through with all of the treatment recommendations. People already waited till they're in pain before they come in. So when they get out of pain, they might be thinking that, okay, it's fine, I'm good, but pain is the last to show and the first to go. So we really need to make sure that we follow through with all the treatment recommendations so that we can change that mobility function scale. So let's go through some of those. Our first phase is the pain relief. And again, people come in and they're in pain. The cause of their pain and other related health problems are something called the subluxation. And what the subluxation is, the misalignment of the vertebrae causing nerve interference. It's a pinched nerve. You might want to think about a hose. If you turn the hose on and you have this nice flow coming out of it, if there's a kink in the hose, you don't have as much flow at the end of the hose. You remove the kink and you restore the amount of flow that comes out. You can think of the subluxation much like the pinching or the kink in the hose there. We don't get the nerve flow that needs to go to all the parts of the body. Because again, there's a lot of problems that you may not think that come from this because of the nerves go to all parts of the body. So right here, we have again the subluxation. What it is the bone out of place, putting pressure on that nerve, that decrease in nerve flow and pressure on that disc. And over time, when it's left like that, you get this. It's degeneration of the spine. So that's what we need to take care of because that can cause a lot of things to happen. What's the solution? The solution is the adjustment. What the adjustment does is takes the pressure off the nerve and then allowing the nerves to function the way that they need to. So we gradually move the spine back into the proper alignment, away from the nerve, and allow the body to heal itself the way that the body was created. Much like you think if you cut your finger, the body can heal that. That's how it's set up with the rest of the body. If the nerve flow is functioning appropriately, we can get things functioning the way that it needs to. So the pain relief is only the first stage of care. Again, and you don't want to stop there because much like I just said, pain is the last thing to show up and the first to go. So now we need to move on to the stabilization phase. So after the pain is gone, why do people have to keep going? And again, this plain and simple matter is the spine has been misaligned for a long period of time. So we need now to retrain the muscles and ligaments to accept the new position as normal. And it does take time. You know, unless the spines and joints are retrained to hold those bones in the proper alignment, it will just slip back out of place. And your body naturally goes to that misaligned position. So why does it take time and work? Let's just think about just going to the gym. You don't just go to the gym once and have big muscles, right? You don't just lift once and look like Mr. or Mrs. Olympia. It takes that repetition to go to the gym. It's much like if you think about the orthodontist. I know when I took my daughter to get braces, they didn't just put the braces on one day and take them off the next day. No, they went through about a couple years, keeping them on, retightening them, and then when she got them off, she had to wear a retainer, and in fact, now she has a permanent retainer. So it's very much the same thing, that it's going to take time and work, and you need all of the treatments to make sure that you get your spine to where you need it to be. And then once we do that, we reach maintenance care. Your spine is out of pain, it's stabilized, and now we're into maintenance. And this is the phase where we change that mobility function. It's simple, it's affordable, but it is where we get the most changes. And that's what people want. People come to us and they want to be able to live a long, healthy, happy life. But you know, we get this all the time. People always say, I knew it, I always heard, once you go to a chiropractor, you always have to go to a chiropractor. And what I say to that is you're right. You know, if you think about this, let's be honest here. Is there any doctor that you've ever gone to that has not told you to come back, right? You didn't go to the dentist and they said, don't come and see me until your teeth fall out. Or just say when you were in the 3rd grade, you didn't go to the eye doctor and they said, you're fine, when you go blind, come back and see me. They wouldn't say that. Quite frankly, that would be malpractice. And we're not going to say that either. We are going to give you what you need to be able to function the way that you need to. You know, we've been in practice for 20 years. Our adjusting rooms are full. We don't want to give anybody any more recommendations than they need, but I want to give them what they need to change that mobility scale. You know, again, we can't remove wrinkles and we can't make your teeth stay white, but we will be able to allow you to move and to function throughout your life. And at this point, I just want to talk to you about, I am really, really passionate about this. Again, I've been under chiropractic care for about 25 years. Dr. Scott, fortunately, is my chiropractor, so it's very easy for me. We have 3 children that have been under care since their birth, and everybody does extremely, extremely well. So it has been life-altering for me. It's life-altering in our office because we have patients that come in and we go out and do screenings in the community all the time, and I'll give you a couple examples. One patient, she came to me at a screening and she said, Dr. Gail, I don't know if you can help me. I've been to everyone and I have these serious, serious migraine headaches. In fact, I work out of my home because I'm on so much medication and I want to be able to go out. And she wanted to get married and have kids, so she wanted to kind of change the path she was on. So I said, you know what, come into the office, we'll see if we can help you. You know, we brought her in, we did a consultation, examination, and x-rays, and we found a major misalignment in the upper cervical region of her spine. She was getting a series of adjustments, and she's doing fantastic. She's already had 2 children, and now she comes in for her maintenance. So for me, this is why I come out into the community to educate people, because there's a lot of people that don't know about this, that there are other things that can help them, and it's life-altering. Recently, we had one of our seniors come in, and she was having some real problems with her neck. When I talked about earlier that lack of being able to turn it at all, she was in severe pain. Now she's on her maintenance schedule. I just saw her the other day. She's back to all her exercising routine. She's so happy. And you know, in the beginning, she wasn't sure we could help her because she was already, I think she was in mid-80s. And she said, I don't know if there's anything you can do for me because I'm already into my 80s. But we have been able to change her life basically to allow her to continue to do the things that she wants to do. So again, we see all of these things happen all the time, and that's why I like to go out and share them with people, and that's why I am so passionate about educating the public about it. But you might be thinking, you know, enough about me. This is some information my family has never heard of. Some of them might not have even known about living this long or things that might be happening to their spine. Can the scales be changed for them? And it's never too soon to start. We even take care of kids. We just had some twin boys come in the other day. They were only a month old. Because if you can see, the trauma of childbirth on the spine is really a lot. You know, they get a lot of problems that start right from birth. And the good news is, with a little preventative care, we can eliminate a lot of the healthcare problems that they might have coming down the line. So it could be one of the best investments you could make into their retirement years. They need to be able to know how to move around. So that's really, really vital for you and your entire family. So again, we are out dedicating and helping people to stay young. That's our office information. I am going to talk a little bit now about how this kind of relates to the rest of the spine. Okay, so what we have here, just so some of those things that I was talking about, we're looking here, what we look for is some of the symptoms that might be related to some of those problems of the spine. So here we look at the autonomic system. Here's your, in the upper cervical region that I talked about, a lot of possible symptoms you can get with misalignments of that is headaches, head cold, dizziness, some people with high blood pressure. Here we have people that come in, have problems with their second cervical, a lot of problems with allergies, sinus troubles. We get a lot of good results with earaches. And again, what we're talking about here is the nerve flow to that. We don't say that we cure anything, but we are trying to remove the pressure from the nerve going to those parts to allow that area to function the way that it needs to. As we go in down and through here, we get a lot of patients down in their lower cervical with stiff neck, pain into their upper arms, some people with a chronic cough. The rest down here, the nerves go to all these organs. And as we come down in through here in your lower back, we see patients with your classic sciatic problem going down into the leg, that big nerve, that low back pain. Also, we get some people with poor circulation in their legs. Some patients that even come in with just lower leg pain and don't relate it back to their back, and that's what we're seeing there. Just so that you see with the peripheral system is here, you have nerves that go up all into your head from the lower portion of the neck down into the arms and the hands. A big thing for us is we'll get people with numbness and tingling down into their arms and hands. Again, we have nerves all throughout here and down here, down into the lower leg, into that big, again, sciatic nerve, and down into the feet. So I like to explain that to people because people sometimes don't understand how the nerves are related to their entire body. Some other things we see a lot with, recently we're taking care of a lot of people with scoliosis, because what we're seeing here is that curvature of the spine. So we get the kids adjusted and try to prevent that curve from increasing there. We give them especially some at-home spinal exercises to do as well. So those are some things that we as well see in the office. Again, we had talked about the degeneration of the spine. And this is exactly what's happening. Here you have the normal neck curve. You have the bones moving out of place, the pressure on the nerve, and then over time you get that arthritis, that degeneration of the spine. So you see those areas there, these pointed areas are those degeneration of the spine, and you get a lot of then increased pain and increased pressure. One thing we like to work with too with people is their posture, making sure they have really good posture, because we can see here Here we have a nice curve in the neck, good posture, but this is what tends to happen to us. Especially now we're seeing a lot with people with text neck because they're tipping their head down and they're texting all the time. So we get a lot of weak muscles in the front here, really tight muscles in the back here, and really, really poor posture. Well, the head weighs a lot. It's about, the size of a bowling ball almost. It puts a lot of stress on this lower portion of the neck. So we need to make sure we keep that the way that it needs to be. And we do also take care of a lot of whiplash injuries, because this is one thing that people really don't think about. After a car accident, their neck, it's in a whiplashing effect. We get some even tears of the ligaments there, and we need to make sure that we are able to, that's pretty traumatic there, we're able to get that rehabilitated so that it doesn't cause a lot of problems down the line. So those are some of the things that we take care of and that we look for. Is there anybody that has any questions that they want to ask? No? Okay. Well, I want to thank you all for coming, and I hope that I was able to give you a lot of valuable information on how that you are able to take care of yourself and your spine as you are aging. Thank you very much.